Dr. Saunders just got her doctorate in coronavirology. So I asked her, how did you know to do your doctorate in coronavirology? And she explained that it's existed forever. So Dr. Saunders, tell me a bit about that.
Hi, yeah, thanks so much for that introduction. So I started my doctorate about 4.5 years ago now, and this was a time when if you said the word coronavirus to almost anybody, they had absolutely no idea what you were talking about. They might have kind of gone a bit blank and glazed over slightly. And I could not imagine that 4.5 years later, coronavirus would be the only thing that anyone in the world would be talking about. So the reason that I was interested in coronavirology to begin with is because I am a vet by training. I worked as a shelter vet for a little while, and there's a disease called feline coronavirus. This is a coronavirus just like the one that causes COVID-19, but it only affects cats. It doesn't affect humans. And it's a really nasty virus. It's actually very common. It exists in most cat populations worldwide. If you have a cat at home, then there's a fairly high chance they will have had feline coronavirus. But then it does this thing where it kind of...
It had feline coronavirus. Was it labeled feline coronavirus from the vet itself?
No, probably not. We just know from doing surveys of cat populations that quite a lot of cats will have had it and will have just had no symptoms. So there'll be absolutely no way of knowing that they were ever infected. But then when we go and check the cat's blood, we can see that they have antibodies to this virus, which means that they were infected at some point in their lives. The really nasty thing about this virus is that it kind of does a switch. So in some cats, or in most cats, as I say, it's completely harmless. You won't even know they have it. And then in about 5 to 10% of infected cats, they get really, really sick and they die. There's essentially no treatment for them.
So this feline coronavirus has been around since the beginning of time, correct?
I mean, the feline coronavirus probably emerged into cats in the 1950s or 60s. So actually, it would have been quite a similar event to what's happening now. It probably would have jumped from another species into cats, and then just like we're seeing with COVID-19,
it emerged. It emerged.
Yeah.
It's however it existed prior, because you were saying before the call that it existed from. It's always.
I mean, coronaviruses have existed in animals for, thousands of years, millennia. So what we're seeing with coronaviruses is that they mutate quite easily and they also jump species. So what we probably have are actually, thousands and thousands of different strains of coronavirus that exist fairly peacefully in all animal species. And then when you get the virus...
When you say all animal species, human animal species as well, that it's existing. So we've always had this strain of corona, but it's been very calm within our systems and we haven't had any symptoms.
So the strain that causes COVID-19, SARS-CoV-2, that is new to humans. That's completely new. And that's why it's so damaging, because we are completely...
So this strain is new. However, we've probably had other strains within our system that have just...
Yes, absolutely. So we have probably about 4 different strains of coronavirus that continually circulate in the human population and cause common cold-like disease. Probably, maybe hundreds of years ago, those viruses jumped into humans and caused something like what we're seeing now with COVID-19. But once they become established in the human population and people build up immunity, they stop being so damaging. So they just circulate like a normal cold. And probably in the future, this is exactly what COVID-19 will be as well.
It will be a cold. Okay.
Probably, yeah.
So how it jumped from animals to humans, human animals here, during this pandemic. And you and I, as we were talking before, we were talking about wet markets. So if you could briefly explain what a wet market is, because I don't know if everyone understands how important and how horrible wet markets are and how they most likely are very indicative of how this all transpired, correct?
Certainly, yeah. So the best theory at the moment is that COVID-19 came from a wet market. That's also the case for SARS, which is the very closely related coronavirus outbreak that happened about 2 decades ago. So a wet market is a place where animals of all different species, so you have wildlife, you have domestic animals, they're crammed together into filthy conditions. They're often in cages that are stacked high. Some are alive, some are dead. Sometimes you have living animals tied to dead animals. There's blood, there's feces. And then amongst this all, you have humans walking around the market, people who work there or people who want to buy things. And you couldn't design a better place for a disease outbreak to emerge. When you put animals together in highly stressful, very dirty conditions, then you're going to get diseases proliferating in that environment, and they will jump to humans. And that's exactly what we've seen with COVID-19.
And what's interesting about the wet markets are, I believe many people would say, oh, well, that doesn't exist in this country. That's over in Asia and so on and so forth, and other continents. And that's not true. There are wet markets even in New York.
I've heard that.
Yeah.
Yeah, I was surprised to hear that as well. Apparently, they're not so much wildlife markets, but I think it's so important not to just point the finger at China and say, oh, wet markets are awful. When we look at what we've got going on in the West as well, so factory farms where animals are crammed in together,
yes,
filthy conditions, that kind of thing, also a breeding ground for disease. And we've seen it. We've seen bird flu, we've seen swine flu, we've seen mad cow disease. All of these things jumped from animals into humans because of the way that we exploit animals.
And to just a little bit more about the disease itself, and then we'll get into dogs and cats and transmission and stuff. So in the wet markets, there's an animal called what's it called again? The
pangolin.
Pangolin, which is
pangolin, yeah.
Pangolin, right?
Mm-hmm.
Right.
Yeah.
It's a trafficked animal in the world, actually. And I saw a documentary about it a couple of years ago. It's this cute looking, it looks like a little, like almost like an opossum covered in scales. That's the only way I can describe it. And it just waggles along. Mm-hmm. And its scales are sold as medicine. Now, these pangolins are also in the wet markets. And the theory, as you were suggesting, what researchers believe is that the pangolins have the virus on their scales. They were in the wet markets mixed with all these other animals, and it was transmitted to these animals that were then sold to humans, and also being mixed with humans walking around and touching and so on and so forth. Is correct?
Yeah, so nobody knows for sure exactly how COVID-19 started, but the best guess is that it probably came from bats via an intermediate host, which in this case is most likely pangolins, and that happened in a wet market. So as you say, a pangolin in a wet market being sold either for their scales, which are used in traditional medicine, or their flesh, which is used to eat, and then humans kind of mingling with those very stressed pangolins, sharing the same airspace, possibly touching them and then touching their faces. It seems very likely that would be how the disease emerged in humans.
And the pangolins, how did the bat transmit it to Luke is very bored, my dog, about this conversation, by the way. The bats, did the bats, their feces dropped on the pangolins, or they bit the pangolins? How would the bat transmit it to the pangolin?
I'm actually not completely sure about how that transmission would have happened. I think probably feces is the most likely route, because I don't think that the bats would feed on the pangolins. But yeah, I'm not sure about that.
So, okay, well, that's something I'm going to look into because I'm curious. So now let's talk about, there have been several cases of corona in the animal world, in the feline world, in the Bronx Zoo, and several cats. Are they actually getting COVID-19, what we're getting, or they're getting a different morph of it, a feline morph of it, like, almost like just a respiratory infection? Because I've been reading so many different facts about it.
So there have been rare isolated cases of companion animals and big cats in zoos getting COVID-19. So this has been confirmed. They've taken a sample from these animals and done a test on them and shown that it is definitely COVID-19. But it does only seem to happen in very, very rare cases. And if you consider that so many of us share our homes with animals, right? And there are over 1 million cases now just in the US. If there was more of a transmission from humans to companion animals, we would expect to see so many more cases in our cats and dogs by now than we're actually seeing. So the comforting thing is it does seem to be very, very rare.
So it is rare. So if someone has COVID-19, did they then gave it to their animal, or did the animal give it to the human animal.
Most likely the human gave it to the animal. Yeah,
Mm-hmm.
that's almost certainly what happened.
And companion animals, because they're out more, they're not isolated. So if I have a companion animal and I go to the food store and take that companion animal, it's having, its exposure is more, correct? Is that why companion animals are getting it more?
So it seems to be that people in the household would be giving the virus to companion animals. In the very rare cases that it is happening, most likely there would be someone sick in the home, and then that person would infect their animal. So that's why the best advice at the moment is that if you are actively sick with COVID-19 and you're showing symptoms, you should try to distance yourself from your companion animals as much as is practical. So obviously that won't work for everybody. You know, if you live alone with your dog, then of course you have to spend time with your dog. But if at all possible, if you're actively sick, you should try to get someone else in your household to look after your companion animal. And if you can't do that, then the best thing is to wear a face mask, wash your hands regularly, practice good hygiene.
So we don't really have to worry about our pets giving it to us, but if we, God forbid, are sick, we can give it to them. And is it the same thing where, you know, with humans, it's more the respiratory droplets? Is it the same thing for giving it to an animal where the respiratory droplet would fall on the animal's fur? But isn't their body makeup is so different in that sense, right? So how could they contract it? Would it be from petting? Would it be from lying in the bed with you, or that fabric
Yeah.
hold it?
So just to reiterate what you said at the beginning of the question, because I think it's a really important point, there's no evidence to suggest that our companion animals pose any risk to us. So I would just say to people, don't do anything differently unless you're actively sick and you're taking steps to avoid your animal as much as you sensibly can. You don't need to do anything differently at all with your companion animal. I don't know for certain that the research has actually been done to show exactly how the virus is transmitted to companion animals, but most likely it would be the respiratory droplets that you were talking about. It can also be transmitted via surfaces. So if you had viral particles on your hand, by surfaces, so if you have viral particles on your hand and you touch something and then say your dog licked that surface,
Right.
then that could be a way it could be transmitted. Another way, which is slightly more gross, but I feel I should mention it, is the fecal-oral route. So it seems that the virus does infect the cells of the intestine, and then it comes out with the feces. And of course, if you're going to the toilet and not practicing good hygiene, then that could be another way that your dog or cat could be infected.
I just had the worst visual of my life.
I felt I should mention it, but we can move on from that subject.
Anyway. Well, you're going to give the facts, so you know that's part of it.
Yeah.
And it's because we're talking about feline coronas. So what about dogs? Where are they in all of this?
So there are a couple of canine coronaviruses that we know about. There's a respiratory one and there's an enteric one. They don't seem to be such a problem in dogs as they are in cats. Of course, you know, like I said, all species have their own coronaviruses that circulate. Some of them seem to be more devastating than others, and that could well be to do with how recently the virus entered that species. So like I said, if it's a relatively new virus to the species, the animals or the humans will be naive and they won't have good immunity to the virus, so they'll get severe disease. Whereas if it's a virus that's been circulating for hundreds or thousands of years, then likely the population will have built up really good immunity and it will be, you know, just like a common cold or not really anything at all.
So if it's been around for thousands of years within felines, why are cats getting it now? Shouldn't they have built up that immunity?
Sorry, I should make clear. So SARS-CoV-2, the virus that causes COVID-19, is new. Well, as far as we know, it's new to cats and dogs and all of the domestic species that we're interested in. It's probably been in bats, you know, for hundreds or thousands of years. Or whatever animal was the original host, it will have been in them for a long, long time. But it is new to humans and it's also new to our companion animals.
And why are more cats, it's confusing for me, but I want to try to understand it. So I'm sorry for repeating myself. Why are more cats getting it than dogs? Or it's just that there could be as many dogs getting it and we're just not aware?
So it seems to be that cats have a version of the virus receptor that's more similar to ours. So the virus, in order to get into cells, it attaches to a receptor which sits on the surface of the cell, and that's how it gains entry. So it's kind of like a lock and key. So the virus is the key and the receptor is the lock. So SARS-CoV-2 is very, very good at using the human receptor, and that's why it's been so successful at just absolutely tearing through the human population and infecting loads of people. It seems to be pretty good at using the cat receptor as well, maybe not quite so good as the human one, but still fairly good, and worse at using the dog receptor. So it's just less adapted to dogs, I would say.
Okay. So again, it's really the numbers, the statistics. I mean, you have over 1 million people infected with corona, and yet you have a handful of animals, correct?
Yeah,
And
absolutely, yeah.
so from what I'm gathering from the conversation, humans can transmit it to animals perhaps, but it doesn't seem that our pets can transmit it to humans.
Yeah, we have no evidence to suggest that that's the case. And it wouldn't really make sense for that to be the case either, because what we're seeing is humans are the ones who are meeting up with each other, spreading the virus amongst themselves, then going back to their homes and infecting their animals that way. So we're not really, cats and dogs going out isn't really so much of a way that the virus is transmitted. Saying that, I would say it's important to think about social distancing as including your animal companions. So, for example, if you have a dog and you take them to a park where you would usually let them off the lead and let them approach other people, it might be a good idea during this time to actually be more careful with that, because if the dog's not likely to be infected with coronavirus, as we've said, that is incredibly rare. But like any surface, a dog can carry the virus on their coat. So if you imagine a dog being contaminated with the virus, running up to a family, maybe the children are petting the dog, maybe the dog's jumping all over them if they're very friendly. That is one way that the virus could potentially be transmitted. So if your dog is a very friendly dog who loves to run up to people, probably best to keep them on lead for this time. And equally, I know you guys over in the US don't usually let your cats outside, is that right?
Right, it's rare.
Yeah, it's really, really rare there. But if you're out and about and you do see a cat on the street, best not to pet them. I know it's very hard to resist, but I would say during this time.
One of my questions for you is, can you still kiss your dog on the lips? So I guess that answers that.
Well, I think it's different. Okay, if you're talking about your dog who lives in your house, so the dog is a member of your household and you're not actively showing any signs of coronavirus, so you have no symptoms, then that's fine. I mean, I still kiss my dog on the lips.
And my dog as well.
But yeah, no kissing dogs who aren't part of your household.
Okay, you got
That's very important. And if you, as I said, if you are ill and you're showing signs of coronavirus, so you have the cough, you have a sore throat, any of the symptoms that we now know about, best to avoid your animals wherever possible. So keep your distance as you would with other humans in your household. If you don't feel well, don't jump on top of them and kiss them on the face. Just keep a sensible distance where possible.
I'm happy that we're talking about this because I always say education is power, and so when people start talking about, oh, you can get corona from your dogs. Well, now you have the answers, or from your cats, where the chances are so unlikely,
Yeah.
Let me check. Does anyone have any questions? I see there's quite a few comments, but then if there's no questions, I would love to, talk about, we have a couple minutes left, about how there's always a silver lining in everything. And even though this is a pandemic and it's awful and it's catastrophic and it's just beyond, it's surreal, one good thing that has come through is about animal testing, right?
Yeah.
So if you talk about that for a couple minutes, because I think that's really something.
Absolutely, yeah. So something really exciting has happened, and that's the medicines regulators. So that's the FDA, the European Medicines Agency, have decided for the first time ever that vaccines can go straight to human trials and skip out some of the normally required animal tests. So this is huge. This is something we've never seen before. And basically what the regulators are saying are that in the face of a pandemic, when we need effective treatments and vaccines and we need them fast, then some of the animal tests are dispensable they don't serve us, we don't need them, and they don't help us in any way. So what we're asking at PETA is that that the medicines regulators actually take these policy changes forward, and they say, well, if these tests aren't helping us, why not apply this to all drugs going forward from the COVID-19 crisis?
Anyway, the animal testing, it's such an archaic way of testing products, and
Yeah,
it doesn't work, and the validity of it isn't. They're not valid at all. It's
absolutely.
but it still exists, correct?
Yeah. Animal tests are such poor predictors of what will happen in humans. So we have this statistic from the US National Institutes of Health, which is that 95% of drugs that test safe and effective in animals go on to fail in human trials. 95%. So okay, let's talk about the ethics of it for a second. These are animals who are being injected, they're being force-fed, they're being sometimes burned, sometimes mutilated, and then inevitably killed at the end. And 95% of the time, we're not even getting anything that's useful for humans. It's just absolutely bizarre that this incredibly archaic way of doing things has been allowed to carry on for so long. And we're really hoping that this COVID-19 pandemic, as awful as it is the push that regulators and governments need to actually take things into the modern age, use non-animal methods. And if I could just ask people to visit PETA.org, there's tons more information on all of this stuff. And we also have a petition asking the World Health Organization to shut down wet markets. So if it's something that you feel strongly about, just go to PETA.org.uk, PETA.org. I'm too used to being in the UK and sign the petition.
You know what, Dr. Saunders, send me the link and I'm going to post it in the comment section. Okay, guys, so please sign and pass it around, Okay, it's all about spreading the word. Thank you so much.
Thank you.
Have a good day. Bye-bye.